Want to call for a crash
It's a
cart?
sight every student, doctor, and nurse is told to expect. A patient in a busy hospital emergency room is in desperate need of resuscitation. For many years, medical students have learned CPR and other life-saving techniques either through demonstrations on patients or by using dummies. But now, VR equipment like this can give accurate analysis and feedback, showing the student whether their CPR would have saved their patient or not.
The idea is that it's much more accurate to do it this way because the scenarios that are done in VR just provide a lot of authenticity, really, compared to the methods that they currently use, which are either books for medical staff or mannequins that do not provide the tracking of compressions. So this is what we're doing in VR. We are providing a lot more accuracy of training.
Happy birthday, dear Alfred.
This is what it's like to be Alfred James, a 74-year-old man who has the most common audiovisual challenges facing elderly people. Macular degeneration means he can't see properly and has lost high-frequency hearing. He's also prone to cognitive disorders, which means he's confused by what goes on around him. The idea is that by putting on a headset, you can experience firsthand what it's like to be in Alfred's shoes. According to Alzheimer's Research UK, this form of training is so effective that they've created an app which enables you to see life through the eyes of a dementia patient.
Dementia is a difficult condition for people to get their heads around, and there's lots of misconceptions that surround dementia. So in order to raise awareness and challenge some of those misconceptions, we developed a virtual reality experience that tries to put people in the shoes of someone who's living with dementia and trying to show them how everyday life can be more challenging and just how some of the symptoms of dementia can affect the way that they go about their everyday lives.
Virtual reality is helping health professionals to reach parts of our bodies and our minds that were previously inaccessible, and not just as a training tool for surgeons. Now, patients and doctors can take a journey through a diseased organ, for example, a heart valve, where blood is restricted because calcium deposits accumulate.
So here we have the construction of the heart valve up close. Then we can go into many other areas and start to look at how cancer cells interact, for example, conditions that, on the surface we don't see.
While London's virtual reality show ended last Saturday, further technological developments are set to continue well into the future. 宋耀天 CGTN